Hey guys, welcome to the interesting one. This series, we are going to talk about the implementation of AI in real world. So we have made a lot of videos on how you can implement AI in your business in various aspects of your business. This whole series, we are going to talk about how others are implementing AI. We are going to talk about the pioneers in respective fields. So talking about healthcare, talking about education, talking about e-commerce, talking about automobile. We are going to talk about a lot more industries. We are going to pick up some of the best case scenarios wherein healthcare industries, automobile industries have implemented AI and how they are making a way move ahead in using AI right now. So in this video, we are going to talk about three major giants. We are talking about Cleveland Clinic in US. We are talking about NHS in UK. We are also talking about St. Thomas Hospital in US. Let's talk about how they are using it. Before we do that, let's talk about overall implementation of AI and how everyone is doing that, right? So, talk about early detection. So, how can AI be used for early detection of diseases? You talk about a scenario wherein you go to a hospital, their computers and servers are with lot of data, right? For reports from all of the patients are in there, but they never got analyzed. Now, when you implement AI and you analyze that report, you develop a very small module, you develop a very small machine to analyze the data and come up with an output. That will basically get you a lot of information which would be arranged in multiple manners. So let's talk about the example. Hospital have data of all the patients between the age of 70 to 80. They have their blood reports, they have their urine reports, they have their stool reports, they have all the reports which are required, they have their heart reports, right? Now when you develop an algorithm to analyze the data and consider the points that there you will be able to find patterns out of that. And if a patient has got a disease after a certain type of report, that is where AI comes into the picture. So when a new patient comes in, based on all the past data which the hospital has and the AI has analyzed the data and learned the pattern out of it, it is going to help them to early detect what this new patient might expect in the near future and cure it before even getting it to the patient's body. So this is what we are talking about. The second best case scenario is patient monitoring. It takes a lot of efforts for all the doctors to do patient monitoring. They might have a nurse there, right, monitoring the patient constantly, getting information to the doctor, but that's not enough. With all the data of patient monitoring, it would by default give a notification to the doctor that these are the readings and this is what we are expecting based on all the past data records. So that is something which AI can do it for you, right? Predicting all the health risk for across, maybe geographical location, across age, across sexual preferences, across various other aspects. So this can help hospitals to bring down predicting the health risk of every patient and curing them beforehand. Now, let's talk about the benefits for the hospital. We have seen live scenarios where hospitals have reduced cost by at least 20% by using AI. And what's the reason behind that? The hard work of a lot many employees, the power efficiency of the data which has been there, all can be achieved with AI. So let's talk about the very first example, Cleveland Clinic, USA, Ohio, right? Cleveland Clinic is the pioneer in implementing AI in healthcare. They have implemented AI in all the diagnosed imaging. So it has increased the precision and helps them to detect very complex situations like cancer and neurological disorders very beforehand. It has improved the diagnosis accuracy to a lot level. So this not just increases the hospital's reputation, but also helps the patient to get cured very fast. As we talked about in the initial examples, Cleveland Clinic has implemented AI-driven model to predict patients' health outcome. So what it basically does is, based on all the data of all the patients they are having, they can easily predict what is going to happen next, and that is what it's only possible with the current AI. And surprisingly, they have reduced the hospital stays of the patient by 30%. So that's cost effective for the government, for the patient, and for the hospital, all at a single go. Now let's talk about another example, National Health Scheme UK or National Health System UK. So NHS have been forefront of implementing AI, and very same as Cleveland Clinic, NHS uses AI powered system to analyze medical scans, right? So it does the same thing, blood reports, all the imaging, everything with AI that improves the accuracy to a lot level. And not just accuracy, speed as well. Reportedly, with NHS, AI has increased the diagnosis accuracy by at least 40%, and that's a lot, right? That helps patients, that helps hospitals, that helps overall society. Now, one very interesting thing, NHS has also used AI to manage patient flow and resource allocation. So based on the weather, based on how the atmosphere is, they get a prediction on the patient inflow. So they can decide how many doctors to allocate, how to manage the inflow very beforehand it's happening. And that's a huge help for an hospital, because for an hospital to manage resources, it's very difficult. And when AI comes to your cure, that becomes way easier. Now coming to the third example, St. Thomas Hospital UK. I said US, but it's in UK, right? So St. Thomas Hospital has distinguished itself as a leader in implementing AI in healthcare. A key area where St. Thomas Hospital excels is with AI or use of AI in chronic diseases management. This helps them with 35% reductions in emergency admissions for all type of chronic diseases. And that's way too much success with AI. Now, real life data suggests that the use of AI in robotic surgery at St. Thomas Hospital have reduced the average hospital stays by 2 days, right? So again, that 2 days is going to help overall society, hospital and patient all at the very same time. Less pain, less money, more profits. So what are you waiting for? There are so many things you can implement in AI like Cleveland Clinic, St. Thomas Hospital and the National Health Scheme, right? Predictive analysis being the first one, robotic surgery being the second one, patient health monitoring being the third one, and there are many other such use cases you can implement AI in your healthcare facility and help yourself to reduce down the cost, to provide better facility to the patients and have a more comprehensive healthcare system. At Ibiixo, we develop AI models, AI systems for healthcare industry, for hospital, for pharmaceutical companies, for small clinics, everything. In case you're planning one, get in touch with us right now at sales@ibiixo.com. You'll find a very interesting blog, much more detailed than this video, in the description. Stay tuned. Happy AI. Bye-bye.